Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Ria Tanwat Cotrillo. Today on the program, Metro Manila stays under alert level 2 amid the threat of the new Omicron COVID-19 variant. The government fails to reach its target on day 1 of its 3-day nationwide vaccination drive. And the health department says it's only a matter of time before the Omicron variant reaches the Philippines. National Task Force Advisor Dr. Ted Herbosa and the OCTA Research Fellow Professor Guido join us live. The Interagency Task Force has approved the recommendation to keep Metro Manila under Alert Level 2 until December 15. The approval comes amid the threat of the new COVID-19 variant of concern, Omicron. Meantime, what went wrong after the country logged only over 500,000 doses on day 1 of its National Vaccination Days campaign? Let's go straight to the source of the story, OCTA Research Fellow Professor Guido. Professor, good morning. Thank you for being with us.
Yes. Hi, good morning, Ria.
All right, Professor, Metro Manila, as I said, still on alert level 2 despite lower COVID-19 cases. Is this a good move, you think?
Yeah, I think it's a preemptive precautionary move. Right now, the numbers we're seeing are really, really good. In Metro Manila, the 7-day average is 204. And the last time we had the lower number is way back in June 2020, when we averaged 201 cases per day. So this is the lowest since before any of the 3 surges we had. Our positivity rate is down now to 1.47%. It's only like 1% positivity rate. So the numbers are good. So without any threats, we might have moved down to alert level 1. But because of the possible threat of the Omicron variant, I believe this is the main reason we have stayed at alert level 2.
All right. Speaking of Omicron, how concerning is this new variant for those of you in OCTA research?
Well, when the first news came out about the Omicron variant, we were concerned. But of course, we have to put it in context. We don't know much about this yet. We're mainly concerned because it has a lot of mutations. And preliminary data suggests that it is more infectious than the Delta variant. Maybe not 500 times like what I'm hearing, but it could be more infectious still. But we don't know a lot about it yet, even though it's already considered a variant of concern. I think at this time, we're still waiting for more data from all over the world, from the scientists and doctors. And we can't say for sure that this will be a major threat yet. But it's better to be careful now while it's still early.
Right. As they're saying, yes, we should be worried, but we absolutely shouldn't be panicking either. And it would seem for us here in the Philippines, time is on our side, right? As you said, the numbers are looking great. Do you think we are acting fast enough, though, as far as border control is concerned?
Well, I think we did act fast enough. We were pleasantly surprised when we implemented a travel ban on the same day that the UK implemented a travel ban. So on the same day that news came out that there was this new variant from South African region, we had a travel ban. And I think this is a quick response. I hope we can vaccinate more people because part of the reason that surge and the variant developed in South Africa, they're saying that it's because of the low level of vaccination there. Only 24% of their population has been vaccinated. In our case, we're at about 30% of the Philippine population.
Right. And I think another issue with South Africa is they have a lot of immunocompromised individuals there because they have a high HIV infection rate. But, for us again here, back home, should we be banning more countries with Omicron variant cases? I think the big concern is Hong Kong. It is so near, so many Filipinos, going back and forth. But Secretary Negrales said that we will not immediately place countries on the red list unless there are local cases detected there. Should we ban more countries?
Well, I mean, of course, if we want to be more careful, we could just ban all the countries together, like what some other countries are doing. They're banning every country from, or including every country in their travel ban. But I think we have other considerations, and we have to, look at it individually. Like in Hong Kong, they actually have very good quarantine restrictions for inbound travelers. So I think the thought there is that the two passengers who had the Omicron variant might have been stopped at the border, so it's possible that they were not able to spread the virus around Hong Kong. But it may not be the case in many European countries because they're now detecting, this variant in Canada, in Belgium, in many other European countries. So I think at the minimum, we have to have a strict implementation of our international travel restrictions in terms of quarantine and the RT-PCR requirement.
Right, because there were talks of easing quarantine time for inbound travelers, really for the balikbayans who only have a limited time to stay in the country. Do you support this, or do you think we should lengthen quarantine times?
Well, without the threat of the Omicron variant, I would definitely support shortening the travel ban, the quarantine period. But with the threat of the variant, I think we might have to be more cautious with our quarantine, length of quarantine for inbound travelers. So I think we would support that. I'm not sure if it should be the full 14 days or we could go at least longer, like 5 to 7 days.
Yeah, the timing is pretty unfortunate considering that, we're coming up to the holidays, but always better to err on the side of caution. Now, Secretary Francisco Duque says that the entry of Omicron is inevitable. It's really just a matter of time. What should we do for now, since time is on our side? Is our health system ready for another potentially transmissible virus?
Yes, time is on our side right now, Ria, and I kind of agree because we weren't able to stop these other variants from coming in the country, namely the Alpha, Beta, and the Delta variant. So it might seem that it's very likely that at some point the variant will be entering our country. Right now, the numbers are looking good, so we're not concerned yet that the variant is here. We don't know that for sure, but just based on the numbers, I think we would still have a happy end to our year. The threat will probably come in around next year. So I think, as you said, we still have time. We have to scale up vaccinations because this is important. This will help contain the spread of the virus if it ever comes in. And we have to scale up hospitals, like you mentioned, contact tracing, if we can scale it up right now or improve it, and the RT-PCR testing, because there are some test kits which may be able to detect the Omicron variant even without biosurveillance because of the drop in the S gene. So, but I don't think right now that we have those test kits, or at least most of our laboratories don't have those test kits. But that would be actually great because we won't need to wait for 2 weeks for biosurveillance to check for this Omicron variant. We might already know it once a traveler tests positive with the S gene dropout.
Yeah, we would need that information right away in order to contain it. Professor, we will be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, Dr. Guido, or Professor Guido David. All right, doctor, let's get straight back into our conversation. With this threat of the Omicron variant, there's talk of bringing back the controversial face shields. Are you in favor of restoring the policy, at least for the 3C areas or situations?
Well, I think it could help. It could add some protection. I haven't looked at the data on how much the protection added will be for wearing face shields, but even if it's 1 or 2%, if the threat level is high, then I actually personally wouldn't mind it. I mean, right now, definitely we don't need the face shields because cases are so low. Numbers are really good. But if there's ever a threat, and if the Omicron is as advertised, then I personally wouldn't mind if it was brought back, but I will leave it up to the experts to decide on that because I haven't really studied on the effects of the face shields.
All right. Earlier, you were talking about vaccination. Now, just over 500,000 shots were administered on the first day of the National Vaccine Day. And that is a far, far cry from the target of 3 million each day. What do you think the challenges were, and how can the government improve this for days 2 and 3?
Well, there are many challenges, Ria. As we know, vaccination coverage is very high already in the NCR. So we don't have problems around the NCR area. But in many rural areas, there's problems with the logistics in terms of, vaccination sites and the number of gathers. I mean, I'm not involved in the vaccination program, so I can't say for sure, but this is just based on what I'm hearing. But what we also know is based on our surveys, that vaccination hesitancy is significantly higher in rural areas, and that may have contributed to the slower rollout. I mean, I can't say for sure without seeing any data, but this is just my sense of what's happening right now.
So what then, Professor, would be your assessment of the pace of vaccination in the Philippines overall?
Well, I mean, before the vaccination pace was dependent on supply. Now that's no longer the case. We have enough supplies, and we should be able to use up all these vaccines because, from what I heard, some of them may be close to expiration dates. So, either by administering booster shots or, giving vaccines to the unvaccinated, right now I would say that it's, it's below, what I would expect as the pace, or below satisfactory. We really need to vaccinate more people to prepare for the possible arrival of the Omicron. Again, in South Africa, vaccination level was just 24% of their entire population, and this may have contributed to the increase in cases there and the emergence of the Omicron.
Right. President Duterte has again spoken out and said that he's considering mandatory vaccination. What are your thoughts on this?
Well, I'm actually of two minds regarding that, but I think vaccination would really help the country, and perhaps we could do mandatory vaccination for certain sectors which may really require it, especially, for example, tourism industry or, professional athletes. But overall, I still value personal choice and personal freedom. I mean, that's just my opinion that, people should still have to get to or decide whether they will get vaccinated or not. I think the main question is how do we address the vaccine hesitancy? And we can address this through proper information dissemination. A lot of the vaccine hesitancy is due to misconceptions and fake news that are spreading in some networks. I mean, not TV networks, but rather some social media networks.
Yeah, that's right. So do you think vaccination should be open for all? I was speaking to an expert last week, and they were saying the priority should really be to vaccinate people who have not been vaccinated at all rather than, giving the boosters. But do you think it should be open for all?
Well, I agree that vaccination should be prioritized for the unvaccinated. I agree with that. But if we're not able to use up all the vaccines, and some of them will be expiring, I mean, why not use them up for some, use them up as boosters especially for those who need it. So I think we have to take a closer look at, our supplies and, how much do we have and how much we're using up, or how much we're deploying, so that we have an idea if we can use a certain fraction of it for boosters, because we might not be able to use them up. So I think part of it is optimal allocation of the vaccines, but that will include administering booster shots if we have surplus.
Yeah, just a little bit of mathematics that needs to be done there. But Professor, all things considered, cases going down, numbers looking good, threat of Omicron, not reaching the targets for national vaccine days. Are you still hopeful that cases will continue to go down?
Well, I'm hopeful. And I think, for December, we should be safe still. The threat is, for next year, 2022. If a surge happens, it may happen in rural areas or in places where vaccination is low, or it may hit the adolescents who are not vaccinated or children who are not vaccinated. It may happen January or February or March, around first quarter of next year, and well into elections if it happens. I'm not saying it will happen. We're talking about the worst case scenario if a surge happens and if the Omicron variant is as bad as we think it might be. So but I'm still hopeful overall. I mean, we haven't seen these kind of numbers. We don't really know how much the vaccination will negate the impact of the Omicron variant. What we do know is that in South Africa, many of those who are vaccinated were just having mild symptoms, but another doctor reported that those who were unvaccinated or partially vaccinated were having moderate to severe symptoms. So that suggests that vaccines may be working. But again, these are all preliminary data. We don't want to make conclusions right now. We're just gathering data right now.
Yeah, it's pretty frustrating when we don't have all the facts yet at this point. But for now, let's look at the regions here in the Philippines, Professor. Most areas in the country are now under alert level 2, except for Apaya, which is under alert level 3. Can you talk to us about the numbers that you're seeing there?
Well, there are some regions where the hospital utilization is still fairly high. I can't speak for Apaya right now because I haven't checked it right now. I mean, what we do know is that recently the surges happened in Zamboanga City and in Dumaguete and also in Catanduanes. But of course, the numbers are already going down in these areas. So my sense is that the numbers are going down everywhere, almost everywhere in the country. And if they have kept a region at alert level 3, it may likely be due to the hospital occupancy, which may still be above normal levels.
Right. Okay. Always good to hear that the numbers are going down. And, we've just been saying, yes, we can be worried, but we shouldn't panic. But still, I need to ask you this. What is the worst case scenario you are seeing if indeed the Omicron variant reaches the Philippines and it is as bad as they say?
Well, right now, we're still waiting for information regarding the Omicron variant, regarding, firstly, if it's more infectious, that means, the reproduction number is possibly higher. Secondly, if it can decrease the efficacy of vaccines, we know that vaccines will be effective, but could it possibly affect the efficacy? And thirdly, if it will cause more severe cases and possibly more deaths. So if it has all three, then it will be a really bad variant because it will affect us definitely. And that would be the worst case. And it's probably going to, enter the country at some point if it's really as bad as that. I mean, if it's a relatively mild variant that's not as bad as we think it is, then it might not even be able to enter the country because of the vaccinations. But if it's really bad, it may cause another surge, possibly during the first to the second quarter of next year, and that will also disrupt our election process, campaigning, and maybe even the election itself. I mean, we're just talking about the worst case scenario. I mean, hopefully it won't happen. I mean, there's a lot of ifs in that scenario, but it's still a possible scenario.
Yeah, we definitely pray and hope for the best. Professor, we'll be taking a short break once again. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, OCTA Research Fellow Professor Guido David. Professor, welcome back to the show. Now, the health department told local government units to shift back to using RT-PCR tests instead of antigen tests because of the threat of the new Omicron coronavirus variant. Is this a good move? Why should we bring back PCR testing when most people would say antigen is faster, it's cheaper, and more affordable?
Sorry, Rhea, I'm having problems with my audio. I can't really hear
Sure.
what's going on. I'm sorry.
All right, sure, no problem. The health department has told local government units to go back to using RT-PCR tests instead of antigen tests because of the new Omicron variant. Is this a good move considering that antigen tests are cheaper, the results come out more quickly?
Well, I think it's a good move because we need RT-PCR tests right now. In fact, if we could, like I mentioned earlier, if we could have that those upgraded test kits that detect the S gene, that would help us a lot in identifying the Omicron variant if it comes in, even without having to wait for biosurveillance and genome sequencing. Now, the S gene dropout is not a guarantee because some other variants may also have this, but it will highly suggest the likelihood of the Omicron variant. Now, I have to mention that the reason they're having surges right now in many countries in Europe is that a lot of the countries have actually stopped using RT-PCR testing. And so now the cases have increased there. And in Germany, what I heard is that the government has suspended the free RT-PCR testing so that the people on their own might not be getting tested, and that may have caused the surge in Germany. And I also have to mention that the surges right now in Europe all started around late October, so the timing seems a bit suspicious. I'm not implying anything, but I'm just saying that the timing seems very coincidental. But yeah, regarding the testing, I think we definitely should have more RT-PCR testing. I know it's more expensive. We can augment that with antigen testing in certain cases. For example, those showing symptoms may just have to undergo antigen testing because that may be sufficient.
Right. And if you get, if you have a cluster, you probably only really need to test one person in that area with an RT-PCR, then you just assume everybody else has that particular variant as well. But the good news is, I believe Dr. De Guzman of the DOH says that we do have the capability of detecting the Omicron variant here, at least in the Philippines. Again, we keep saying, worry about this variant, but don't panic. But one interesting thing that has some experts wondering is it seems that there might be a higher chance of reinfection with this Omicron variant. Meaning, if you've had it, if you've gotten coronavirus before, you could probably get this one again, or it's more likely. Can you talk to us a bit more about that?
Yeah, and that's a very interesting information that that we're also waiting on for, internationally. We're waiting for data on reinfection, because what we know is that, more virulent variants like the Delta tend to have higher rates of reinfection. And I know our country is basically Delta resilient because we have seen that the Delta numbers have really gone down and plunged. And, we're averaging less than 800 cases per day. But right now, we don't know a lot yet about reinfection. But if it causes a higher rate of reinfection, that would be, another aspect to add to the threat of this Omicron variant.
Doctor, have you seen anything in the data about, certain races or ethnicities being more vulnerable to a certain kind of variant?
Well, I haven't seen that kind of data. Of course, we know that it's possibly in Europe right now, so, where it's mostly Caucasians, and also in Africa. But what of course we do know is that the variant may have mutated in the South African region because of the high frequency or occurrence of immunocompromised individuals, particularly those who have HIV, and this may have helped the mutation, and that's why it's more or less centered in the African region. Right now, we haven't. I'm not sure if there has been cases yet for Asian ethnicities like ours, because mostly it has been detected in European countries, in Canada, and I'm not sure about the Hong Kong travelers, if what their ethnicity is. So again, the lack of data is still a problem, because I think to date there are still about less than 100 cases identified with the Omicron. So, hopefully we will have more information that will help us, identify ethnicity impacts, if any.
Yeah, we are all waiting for that information. Professor, thank you so much for being with us this morning. We do appreciate it. That was OCTA Research Fellow Professor Guido David. We were supposed to have National Task Force Advisor Ted Urbosa on the show, but unfortunately, he cannot be reached. In any case, thank you for joining us here on The Source. I'm Maria Tanwat Cotrillo. You're watching CNN Philippines.